You ever get that feeling, where your back's trying to tell you something?
Yeah.
And it's not exactly a love letter.
Right.
Well, get this. We dove deep into your stack of info on back pain, all those questions you had. And honestly, it was like we got a PT crash course just for this deep dive.
And a fascinating one at that. You've brought up some really great stuff. Most people, they don't realize how many ways back pain can, well, show up, I guess.
Okay, see, ways, that's where I need the PT dictionary, right? So for those of us who aren't fluent in back pain lingo, what's the most common way it sneaks up on us?
Technically, it's called mechanical back pain. And it kind of is what it sounds like. Something's not quite right with, like, the mechanics of your back.
Makes sense.
Could be that desk job, right?
Yeah.
Turning you into a human question mark all day. Or maybe it's how you're lifting those heavy boxes, even just overdoing it at the gym.
Yeah.
Everyday stuff.
So basically, life is out to get our backs. Got it.
Yeah.
But there's a lot here about posture, too. Is it really that big of a deal? I feel like my mom's been saying sit up straight since I was 5.
It's amazing how much of an impact it has.
Right.
There's this one study you pulled out, found that slouching, over time, it can actually make the space between your vertebrae smaller, and that puts pressure on your nerves.
Ouch. Okay, I'm getting nervous just hearing that.
Think of it like stuffing a suitcase way too full, Eventually, something's got to give.
No more overstuffed suitcase spine for me, thanks for that visual. But then there are the times where it's not just like everyday wear and tear. I'm talking injuries, or maybe you've got a condition that needs a little extra attention. What about those?
Exactly, yeah. So beyond the usual aches and pains, you've got things like herniated discs, which you seem particularly interested in.
Can you blame me? I've definitely had those through my back out moments that make me wonder if a disc is about to go rogue.
We'll get into the specifics of all that for sure. But even with something like a herniated disc, physical therapy can be incredibly effective. That's the thing a lot of people don't realize.
That's where my brain goes with PT, honestly. It's like having a detective for your back pain instead of just slapping on a pain patch and hoping for the best.
And that's exactly what's so great about it. It's not just about masking the problem. Physical therapy, it's about figuring out what's causing the pain in the first place.
Okay, like the sound of that.
Could be muscle imbalances, could be how your joints are moving. Heck, it could even be those everyday movements you're doing without even thinking about it.
So it's like having a personal trainer, but for pain relief and prevention, not just sculpted biceps.
Exactly. Think of it that way. And just like a good trainer, they're going to look at your strengths, weaknesses, how you move, the whole picture to make a plan just for you.
So no one-size-fits-all solutions. Got it. Okay, I'm sold on the why of PT, but what about the how? Like, what actually happens when you walk into a PT clinic? Is it all heat packs and those electrical stim things?
Well, those can be part of it, definitely. But there's a whole bunch of techniques they can use, and it's a lot more interesting than just lying around, trust me. Manual therapy, for example, that's a big one.
Ooh, manual therapy. Sounds hands-on.
You got it. It's all about using their hands to get your muscles and joints moving the way they should.
Hand-on, huh? Okay, now you're speaking my language.
Huh.
Picturing something like a deep tissue massage, but, specifically for my back pain.
You're not far off. Manual therapy, it can involve a whole bunch of different techniques. There was one you pointed out in your research, spinal mobilization.
Ooh, spinal mobilization.
Oh.
Sounds kind of intense.
It's actually super gentle, though. So the therapist uses their hands, right? And they do these specific movements to help your spine move better.
Okay, so we're talking like improving mobility, not cracking bones.
Exactly that. It's about getting your joints back to moving the way they should, which a lot of times that's all it takes to reduce stiffness and pain. Oh, and speaking of tight spots, another one that comes up a lot with manual therapy is myofascial release. Ever heard of that?
Honestly,
Yeah.
not really rings a bell. What's the deal with myofascia? Lay it on me.
So fascia, it's this like thin but strong tissue that's all of your body, surrounding your muscles, connecting them. Imagine like a delicate web, but it's got a lot of strength to it.
Okay, I'm picturing it.
Now, when those muscles get tight, injured, that fascia, it can get restricted too. That's where myofascial release comes in. They use this gentle pressure, hold it for a bit, and it helps release those restrictions, get things moving normally again.
Wow. It's crazy how interconnected everything is in there. But okay, enough about hands-on for now. What about the whole move your body part of PT? Because I know strengthening certain muscles is key, and I've seen a lot here about the core, strong core, happy back, all that jazz.
You're right on the money. Your core muscles, they're like that internal support system for your spine, that natural brace we all need. You actually had some research here showing how a strong core, it can be just as good as an actual back brace for some people. Less pain, better movement.
Get out. Seriously. I always thought core work was more about, like, six-pack abs, not so much back pain relief.
It's both. A strong core, it helps stabilize your spine. That means less pressure on your lower back, less chance of hurting yourself. Imagine, like, the foundation of a house.
Okay, I like where this is going.
You've got a strong foundation. Everything's more stable, right? Less likely to fall apart when things get rough.
Love that analogy. So what are we talking here? Planks, crunches, the usual suspects?
Planks are amazing, yeah, because they work all those core muscles at once. Bird dog is another good one for stability. Even bridges, simple as they seem, can make a big difference. But core strength, it's just one piece of the puzzle. We've got to talk about flexibility, too, especially those tight muscles that love to mess with your back.
Oh, tell me about it. Tight hamstrings, hip flexors. Those don't just affect your legs, right? They can pull on your whole spine, throw everything off.
Exactly. It's all connected, like we were saying before. That's why it's so important to stretch those hamstrings, hip flexors, even your lower back. Gentle stretches, nothing crazy. And those yoga poses you mentioned, child's pose, cat-cow, those are gold for flexibility and relieving back tension.
Okay, now you're making me want to break out my yoga mat. But I also keep seeing these other techniques, like a little more specific. McKenzie method, that one rings a bell. What's the deal with that?
Right. The McKenzie method, it's interesting because it takes a different approach than a lot of other techniques. So the idea is you do these specific movements, and it's supposed to, like, centralize your pain. So move it from your leg, let's say, back towards your spine.
Interesting. How does that work exactly?
So one of their most well-known exercises, it's called lumbar extension. Basically, you're gently arching your back backwards.
See, now that seems counterintuitive. Like, my back hurts, the last thing I want to do is arch it more.
I know, right? It sounds weird, but the idea is by centralizing the pain, you're actually getting to the root of the problem, the mechanical issue that's causing it, not just masking the symptoms.
Okay, so it's like you're addressing the source, not just putting a Band-Aid on it.
Exactly. Doesn't work for everyone, of course, but for some people, life-changing. Reduces pain, helps them move better. It's pretty amazing.
I can see why people would be into that. Getting to the root of the issue, it's always better than just slapping on a temporary fix. And what about aquatic therapy? I'm imagining myself floating in a warm pool, and honestly, that sounds pretty therapeutic already.
Right. It's like a hug for your whole body, especially your back. With aquatic therapy, you're in the water, right? And that buoyancy, it takes the pressure off your joints, which means you can move more freely, exercise more comfortably.
So it's perfect if you're in a lot of pain, or maybe land-based exercise is too difficult right now.
Exactly. Plus, the water, it provides natural resistance, so you're building strength without putting too much stress on your joints. Win-win.
This is blowing my mind, honestly. Physical therapy, it's so much more than I thought. I had no idea.
Right. And speaking of expanding our horizons, we can't forget about technology.
Oh, right. It's not all hands-on and exercises, is it?
Yeah.
Technology's got to play a role, too. So wait, are we talking like robot physical therapists now?
Not quite there yet.
Although, honestly, robot giving me a back massage after this deep dive. I'd be into it.
Maybe someday, right? But even without the robot masseuses, there's some pretty cool tech being used in PT these days. You were curious about 10NS units, right?
Ah, yeah. 10NS. I feel like I remember those from, like, late-night infomercials back in the day. Tell me those actually work.
Well, they're legit. So a 10NS unit, it uses a little bit of electricity, low voltage, and it basically interrupts pain signals.
Interrupts? Like, how?
Think of it this way. You've got these pain messages, right? Trying to get to your brain, tell you something's wrong. The 10NS unit. It's like that friend who intercepts those calls you really don't want to take.
Pain signal blocker? Okay, I like it. What about the classics, though? Heat, ice. I swear, my grandma could fix anything with a heating pad and a cup of tea.
There's a reason those remedies have been around forever, right? So, ice, cold therapy, that's your first line of defense, especially for a new injury. Remember that study you had about inflammation being a big part of back pain?
Yeah, I think so.
Cold, it helps restrict those blood vessels, less swelling, less pain, at least for a bit.
Ice it down. Got it.
Now, heat, on the other hand, it's more like that warm bath after a long day, relaxes your muscles, gets the blood flowing. That's better for more chronic pain, stiffness, that kind of thing.
Makes sense. I'm definitely more of a heating pad person myself, but I'm seeing some stuff about ultrasound too. Is that the same ultrasound they use for, like, you know, baby pictures?
The one and the same.
Yeah.
But in this case, instead of showing us a little peanut on the screen, those sound waves, They create heat deep in your tissues.
Hmm.
Helps with blood flow, inflammation. Really good for those deep aches that just don't want to quit.
The things you learn. See, this is why I love these deep dives. Okay, so we've got all these techniques, technology, but I gotta imagine what we do outside of PT matters too, right? Like, we can't just rely on those hour-long sessions and call it good.
You're totally right. Think of physical therapy as like they're giving you the tools, the map to a healthy back, but you're the one who's got to do the driving.
Okay, I'm listening.
And a big part of that, lifestyle changes, simple stuff, but it makes a difference.
Lay it on me. What's non-negotiable?
Number one, and I know you saw this everywhere in your research, move your body.
Easier said than done some days, but
I know. But honestly, even if it's just a little bit here and there, it all adds up. Walking, swimming, heck, even dancing around your living room like nobody's watching, it all counts.
got to get those movement snacks in. Love that.
Exactly. And speaking of movement, posture. You even had that whole article bookmarked about ergonomic workstations.
Oh, guilty as charged?
It makes such a difference how you're sitting, standing, even sleeping.
Your
Your back will thank you.
an ounce of prevention.
You got it. And another thing you were spot on about weight management, those extra pounds, especially around your belly. It's like carrying around a backpack full of bricks, 204/7. Not good for your spine.
Okay, I needed that visual. Ditching the invisible brick backpack? Noted. What about sleep, though? I feel like that's when our bodies do their best healing work.
Couldn't agree more. Good sleep, it's essential. And it's not just about how much you're getting, but the quality, too.
Right.
That means a good mattress, one that supports you. And finding a sleep position that doesn't make your back cringe in the morning,
So sleeping like a starfish is probably out.
maybe not the best strategy. Side sleeping with a pillar between your knees, that's a good one for a lot of people. Helps keep your spine aligned. Back sleeper. Pillow under your knees can help, too.
Mental note. Check my pillow situation tonight. Okay, so with all this talk of prevention, lifestyle changes, at what point do we say, all right, enough's enough, I need to see a professional?
Ugh, the million-dollar question. So some back pain, honestly. It'll get better with a little TLC, those lifestyle tweaks we talked about. But if it's really bad, sticks around for more than a couple weeks. Or if you've got other stuff going on like numbness, tingling, weakness, don't mess around. Go see someone.
No more toughing it out, hoping it'll magically disappear.
Exactly. The sooner you get on it, the better. Especially if we want to stop that acute pain from turning into a long-term problem.
Man, this has been eye-opening. I
Yeah.
feel like we went from 0 to 60 on back pain knowledge,
Yeah.
all in like, what, 45 minutes?
We covered a lot of ground, that's for sure.
We did.
Yeah.
So if our listener could only remember one thing from this whole deep dive, what would it be?
Remember this. You are in control of your back health.
Mm-hmm.
More than you think, honestly.
What about?
It's about those small changes to how you move, how you sleep, how you treat your body day in and day out. Even just being aware of your posture, that's huge.
Small steps, big impact.
Exactly. It's about creating a lifestyle that supports a healthy back.
This was awesome. So insightful. And I have a feeling our listeners are walking away with a whole new understanding of their back pain and what they can do about it. So here's to a pain-free or at least more manageable future for all of us. Until next time, keep exploring, keep asking questions, and we'll see you in the next deep dive.